But more so, what I found that we actually missed a very, very important piece in recovery. Nobody talks about energy, and energy is so fundamental. From physics on a particle level, you cannot run any chemical reaction without electron to be in excited state. Yes, you need that physical energy, fundamental energy, to do anything in the body.
Here we are. Okay, I'm with three super exciting people, and I'm really looking forward to this. And we're talking, this is the future of medicine. First, Dr. Zulia Frost, Medical Director, Clinical Director of Recharge Health, renowned worldwide expertise in light and energy therapy, and she's worked on over 10,000 patients. I'm so looking forward to talking to you. I've just experimented around with some of this stuff, and I'm going to tap into your experience. And Bjørn Ekeberg, Chief Commercial Officer, Recharge Health, PhD in philosophy of science. Used to be a screenwriter for Netflix, which I'm sure they and also Arjen Helder. Okay, this is, I think, the third time we've talked. Brother, you are this guy is a mad scientist. Okay, chief designer, inventor, revolutionary discoverer of the flex beam, and engineer and head hardware technology. Welcome to all you. I mean, I'm so thank you for making it. Now, Dr. Zulia, because I've read some about your story. Can you share how you went from a medical director to co-founder of Recharge?
Oh, thank you so much, first of all, for having me on your show. I love it. I always listen and I follow you because I think you make sense. So, you know what, it's very difficult to kind of briefly talk about my experiences in life, but I had a very special experience which brought me into my path, so to speak, because I was at the beginning like very average medical doctor doing very routine work, but then I had a car crash, and this car crash changed my life because I was in such a bad state. I was broken all over, and pain I experienced was enormous. So that, I think that taught me how to be sympathetic to people in pain. It taught me also how I could be strong and overcome things myself. So I basically developed a program, healing program for myself. And within 7 months, I was back on my feet after literally a deadly car crash. So with that, it also changed my perspective on life. And I start questioning the what do we do as medical doctors? Just giving pills, it's not the answer. The answer is much wider. You have to look at the whole, lifestyle. You need to look at your nutrition. You need to look at exercises. But more so, what I found that we actually missed a very, very important piece in recovery. Nobody talks about energy. And energy is so fundamental. From physics on a particle level, you cannot run any chemical reaction without electron to be in excited state. Yes, you need that physical energy, fundamental energy, to do anything in the body. And and that's what becoming kind of my passion and my drive in life. So I found the various devices, I found the various modality, and I applied it in practice, and boom, people start recovering. And people recover and they say, why don't I know about this? Why nobody talks about this? And I just become so passionate about this. So throughout my career, I worked with electricity, with light, with sound therapy, with bioresonance and everything. And so I learned so much. I learned Chinese medicine because of this. I wanted to understand how energy circulates in the circuits of electricity in the body. So And then I met, I started actually first looking somebody who could make devices for home use. Because as a practitioner, you do so much in that hour, but you need to carry on that energetic work at home. So I was looking, and boom, the destiny brought me with, two guys in Thailand, and they were, expats, and they talk in my language. These guys, Arjen and Bjørn as well, joined us. So we all talk in the same language. We all wanted to do the healing with energy. In this case, energy of light. And that's how I joined the team and started working towards creating Flex Beam.
Doc, you are on the cutting edge, okay? And everything is energy. I mean, oh my God. And to have a trauma, personal trauma, you're going to be very passionate about the new therapies. Now, Bjørn, how did you go from a screenwriter for Netflix to leading the company? Okay, and that's a heck of a transition.
Yeah, and so for me, it's I'm a kind of a witness to how amazing these people are, because I knew nothing about this. I had no idea about all that Zulia has built decades of experience with. I was working as a screenwriter based in Norway, but doing some international productions. I had like 2 major TV productions. I was on my way to do a third to actually get it through the funding. And then an old friend of mine, Bergman, who is the 4th co-founder, who works with Arjen in Chiang Mai. He's an old friend and he's an entrepreneur, and he's like often tried to sort of get me involved in something. And I'm, okay, we'll talk later. And this time I could tell it was different by the whole thing, that he's hit upon something. I think both him and Arjen had discovered something, and they just met Zulia. And so I got to meet them. And we had, I would say within a couple of days in the same room with these people, working on the technology, trying it out, speaking it through. We had a very clear vision of like, this is, this has to come out. This is a storytelling opportunity of a lifetime. So my first task that I signed, I didn't sign up to sort of come into this position, but I sort of said, okay, let's make a film. Just the first film about Dr. Zulia and Arjen and Kistam. And when I was on the other side of the lens and I was interviewing them, and also very significantly all the patients that they tried it on so far, I had an experience after from like seeing how the transformation had happened for so many people, that I had a really hard time going back to the hamster wheel of trying to compete for somebody's attention span that maybe on a subway wants to watch something before they swipe right to entertain them for a few minutes, and to be part of this machine when I can actually put some of the entrepreneurial skills and the storytelling skills into something that actually drives value for people, that's meaningful to people. So for me, it was like abandoning almost sort of a path that I was on, but I'm grateful every day for having this opportunity.
And you also have a PhD, philosophy and science. And
yeah, I've worn a few hats in my life, and it's the first one before the screenwriter. I just didn't want to be a professor and working at a university, so I went a different path into creating. I wanted to create something, and I'm entrepreneurial. But for me, it clicked in when I understood the physics, and this is that's my background, this philosophy of physics and science, and to realize this new science. I was like, it didn't hurt me, to put it this way, to get in contact with, start seeing that there is a kind of a paradigm shifting, which is very exciting to be part of, like seeing all the new research. And Arjen and Zulia can speak much more in detail about. I'm sort of just a philosopher, but I do find it interesting to follow, and I think that's very inspiring as well. All the science that's going on this, that's shifting.
It's brilliant. There's a similarity between all of you in this company. I mean, it's like innovative, open to new ideas, fantastic. Now, Arjen, you're chief designer, inventor, revolutionary reflex flex beam, and I've used it on experimenting on my patients with it, which, I mean, really good results. Welcome, brother. I mean, you're like the mad scientist in the jungle in Thailand. Just for people that haven't seen you, how did you get involved in this?
Well, I got involved because I was working for a company that made solar lanterns, And that company asked me a question about LED lights and asked basically, you know, is there any negative health effects of using LED lights? And I looked into that and I studied it quite in depth. And I found a couple of very interesting studies about infrared light. And my wife at the time had lots of pain. She had back pain, neck pain, shoulder pain, a lot of soreness. And I was like, this looks like a good match. So let's try this. Let's make a couple of devices. And for me, it's relatively easy to build something. So I just built it and experimented with it, tried to find the right power levels, wavelengths, and all that stuff. And when I was pretty confident that I had something nice, I brought it home and tried it, and my wife loved it, and it worked really well on her. And before you know it, she tells the neighbors, and they come over, and then they tell their neighbors, and they come over, and it was a constant stream of people coming in and out of my house with pain problems that left with a big smile on their face. So at some point we were like, I can't just keep this to myself. We have to show this to the world, and we have to design the best thing we can come up with, and that best thing is the flex beam. So that's how it got started.
Oh my gosh. Okay, I've got to ask this question to everyone. Okay, frequency medicine. Okay, and it's absolutely the future of medicine. Describe the vision of what you folks are expanding on versus mainstream medicine. Like, what are the differences? How can we get the public educated on this as well?
I think in general terms, you could say that we have to change the narrative of what medicine is to most people. Because when you say medicine, people think pills. And when you say medicine, people think you have to fight a disease. But I think the real paradigm shift needs to come into looking at healthcare and becoming healthy again, not as a fighting of disease, but an assisting of the body to go back to its natural state and to figure out what you can do, what the different things are that matter to get back to the state that you want to be in. So instead of a war on cancer, we need to go to figuring out which things matter and how to adjust them to where you need them to be.
You mean the 50-year-old war on cancer that's tripled the cancer rates in most of the population? It's ridiculous. And that's what I tell people. I say, look, your body is responding correctly based on the stimulus. You do not have high blood pressure, inflammatory bowel, or all the other stuff that people treat with a toxic chemical. Now, it would be neat if we could talk like it's 1999. Dr. Zulia, okay, now, I mean, you went from the pharmaceutical-based healthcare to this. Can you explain or share the clinical effects of FlexBeam and some patient stories?
Yes, with pleasure, with pleasure. And Dr. Bergman, I want to tell you that I've been on this mission for 25 years already, been on the forefront, fighting for frequency-based medicine, because, I could see results in my clinic, yeah? So first of all, I want to talk about just broad aspect of effect from FlexBeam, such as energy. In my view, the human body is a battery. It's polarized, it's charged, every single cell is charged, the electricity flowing all over the body. So you need to give body energy to heal itself, like exactly what Bjørn said, empower your body to heal itself. So number one effect is energy effect. And here we're talking about whether people just fatigued from, stressful life, whatever, or maybe people have like fibromyalgia or serious illness when they fatigued. And it could be, of course, this right now people are fatigued. I see lots of people with long fatigued. And of course, what you need to recharge mitochondria, you need to get the energy in the system. And it works just like solar panels do. In a similar way, the body accepts the energy and translates into flow of electricity, flow of electrons, charging your membrane, making the potency. And of course, another application, it's in performance, sport performance. Again, people have fatigue after over-exercise, and it's the same story. You just recharge the body. And of course, with energy, you can have other effects, like if you're talking about cellular effects on the body, then you know about the ATP production increase, a little release of reaction oxygen species, which like trigger all these transcription factors and everything. And nitric oxide is a vasodilator. It's ultimate vasodilator. So you can have blood flowing better in certain areas. So all these three physiological effects translates into something which tangible, pain relief, muscular spasm relief, improvement in your arthritic joints, back pain, neck pain, shoulder pains, and recovery from injuries. So people just using this energy from the device to help to recover them from injuries. So I could have, I tell you one story, very, very good. It's demonstrate how powerful it's for pain relief. I had a woman reach out to me, and she said, through customer service, and she said, I want to be in a study, have fibromyalgia, 5 years. I've been everywhere. I've obviously seen biomedical doctor, and 5 years suffering, severe pain, 9 out of 10. So with her doctor being on board as well, we sent her a device. It was through the COVID times, and she was using it daily. She got, from the first session, full pain relief, like the pain's gone, from 10 down to 0. Wow, remarkable. And then she started kind of going at it. And after 3 months, her pain dropped from 9 or 10 down to 3 and 4. And then extra months get her to 2, 2 out of 10. And she was doing all housework. She dropped all her medication, no need sleeping pill, no need pain medication. This is beautiful story. She's very happy. She's happy to tell the world about her experience. With the recoveries, I have stories, lots of athletic injuries, lots like Achilles tendon, rotator cuff. You talk about the broken ribs. I had one guy who walked in and he said, I want to be in the study. I just broken my rib. So we put the flex beam over this fracture, and he came for 3 days running. I booked him for the whole week, and in the 4th days, he didn't come up. And what's up? And he said, I don't need to. I said, no pain. Oh, it's healed completely. And with Achilles tendons, I have very good results, very fast healing.
I love the way you put it, because when you're talking fibromyalgia, there's usually a structural problem causing the muscles to be in a chronic state of spasm, and putting energy in. I love the way you worded that, because these muscles that are in a chronic state of spasm, they go to anaerobic, where they produce lactic acid and they just get drained and scar tissue. Putting energy in, the way you're describing it, stimulates the mitochondria, stimulates vasodilation, stimulates tissue production. There's not a drug in the world that does that. And you're putting the energy that body needs in that area. God, I love the way brilliant doctors word this stuff. Okay, now Arjen, the science behind this, because Dr. Zulia, when you're talking about putting energy in and you're increasing how the metabolism of that, how the body can regenerate and vasodilate and everything else, what's some of the science? How does FlexBeam do that?
Well, I think we have to take a couple of steps back and really look at the relationship between our bodies and light itself. Our bodies are as dependent on light as plants are. There's simply just no difference. But there's a huge difference in how much light we get compared to, let's say, 150 years ago. Because practically, since the industrialization of the world, the Industrial Revolution, we are sitting indoors. And the light that we get mostly is artificial light. So I think you have to start there and ask yourself, what was the natural relationship that humans had with light? Well, we were out in the field, we were out walking outside, and we spent as much time in the sun, as we could, pretty much. And all of that has completely changed. It has completely turned around. And I think we should not underestimate what the long-term consequences actually are. And it's hard to see because that was a couple of generations ago that we made that change. And I think slowly but surely we're realizing that the fact that we are constantly indoors, that we drive in cars, we go here, we go in a building, how much time do we really spend in the sun? And how much time did we spend in the sun 150 years ago? There's a huge difference, a really huge difference. And I think that is something that we have probably overlooked. It's like, this is how important light is. If we are as dependent on light as plants are, I mean, tell me, Mr. Bergman, how many plants have you thrown away in your life that were indoors?
Everyone eventually.
That's what I mean. But we are there. We share that space with them, right? And our bodies are as dependent on light as plants are. And we throw the plants away all the time. That should kind of tell us something, right?
Absolutely. Because I've got a question for everyone. Because, well, I was describing Rife technology, back in the 30s, how he was trying to see smaller and smaller stuff. He had to change the frequency of light. And he realized that certain cells underneath that frequency would develop a resonance and explode. So he was using energy to reverse disease processes. Now, the new science, light and energy, when I say new science, it's been around for 100 years. But it hasn't caught on, or more than that. Yeah, well, thought process, that's an energy and a frequency.
Well, what did people used to do? I mean, you used to get a disease, an illness, and what did you do? You went to some mountain resort, and the treatment was you have to stay outside. I mean, before we had modern, let's call them chemical medicine, but that's what we did. And guess why? Because it works.
Now, how do we change this from fringe, which is actually the true science, okay, of energy, light, everything, on how the body regenerates? You're helping the body processes. How do we get it to mainstream, which is really symptom-based, chemically based healthcare? I'm opening this to everyone.
Change the narrative. We have to change the narrative from fighting disease to supporting health. That's the only way.
The way to change the narrative also is to actually, through the technological revolution, that I think is important also, is like, we couldn't make a flex beam 20 years ago or 40 years ago or something like this. We know about the general impact that sunlight has, but some of the very specific things that we're able to do now, I mean, Adrian can speak to this directly, but just how recent it is, the advances in LED technology that make it possible. That you can actually change, if you're going to change the narrative, you have to give people a reason to actually believe in it. And we can make this more powerful now than just general sunlight is, right?
Yeah. We have about 10 times the power at the wavelengths that we use as compared to sunlight. So that's a significant difference. Next to that, the irony actually is that it's the surveillance industry that has made the LEDs possible, that has created the demand for the LEDs that we use today in our products. Really?
I love that.
Isn't that ironic?
I think also we need to give this technology in the hands of people, because the more people use it every day, the more they understand, they build up relationship between, for example, flex beam and the body. It's become part of the routine, and that is changing them. And trust me, all my patients would stand behind me now, like an army now, and they all would say, now we just believe in your devices. We don't need to go, unless it's a serious operation, of course, surgery. But otherwise, they don't need to use hospitals. If their mentality changed by using this, by believing in that.
Wow.
I would just add to it, if I may, that it's we live in a 3-second world. The short attention span that people have. That's one of the challenges that we face. And then getting people to open up to a different narrative. It comes through the product. It comes through helping in some way. But just to be able to meet people where they are, we have to also innovate and make it so easy to use and accessible that it's undeniable that the effect grows from the 8,000 people who've caught on to it so far, that it grows to 100,000 and million. It goes through, that the technology is good enough and we can show it in practice.
So you folks are developing and utilizing products, okay, with technology that's been around for a while, but you're refining it, making it portable, making it more effective. And all of these products help the body regenerate. It helps all the body processes to build cells faster and healthier than they break down. And that's what I continually talk about to my patients, and which is going completely against the chemically based, where it's symptom-based healthcare. You guys are talking about regenerative tissue. Like I've got a lot of medical doctors that work for me in Mexico at our clinic down here, and their medical education is more, look, if you find something that works, okay, it's working. So be open to that. The medical doctor patients that I have up north, it's more of a religion. Okay, so now what's coming next for Recharge Health, and how can we increase awareness? Because we have, you have truth and anatomy, physiology, measurable stuff that we can put to explain to people. How do we increase awareness? How do we increase awareness that the body's designed to be healthy?
I mean, you're certainly helping and doing your share. So thank you for that. And we are trying our best to get this out to more people. So as I mentioned before, like we have a product that is, therapy. It needs to be on people. And then we had to launch during the time at which we were all isolated. We could only speak digitally. That was like one challenge. And now we're just started fundraising during a stock market crash, which is, very timely. But we are raising some capital now to fast track the innovation and fast track the distribution. We are basically at the point of we are sort of self-funded through sales just so we can keep it going. But in order for us to really make a mark and to reach out, we do need more firepower in all directions. So that's something, that's what we're working on the backside. And then Adin and Zulia are heavily engaged in top secret project, or what can you say about it?
We do a lot. I mean, everybody does what they do well. And I think that's the strength of our company. We all have our own specialities and we keep on pushing the boundaries on what we can do. I mean, I'm obviously the tinkerer, this is an example. This is something I put together before the meeting. People may not know, but it's about 12:30 here. It's past midnight and I had a couple hours to kill. So I made something. I actually went to the dentist today and I had some pain and I still had some anesthetic in there that wouldn't go away. So I made a solution. So, this is what I do. And whenever I find a problem, I try to find a solution for it and I put it together and I test it. And if it's promising, we put it in the collection of weird stuff that Arjen made. And we start trialing with it, and eventually some of those things will make it into the mainstream and will become a product. So that's kind of how I work. I mean, people call me or contact me and they say, "Hey, Arjen, I have this issue. What can we do? What do you recommend?" And if I can build something, then it takes me a couple hours. But I have a 3D printer and I can put some stuff together. And this is how I keep pushing the boundaries on my own understanding of things, of the technology, of and all the while trying to make sure that what we're doing is actually affordable and easy to use. So it's one kind of random example on how we keep pushing the boundaries here, and everybody does that in their own domain.
Yeah, I got to tell you, when I describe you to my patients, has like the Dr. Frankenstein in the jungles of Thailand, except Frankenstein would animate dead tissue. You're animating living tissue. I mean that's like cooler, because you're literally making living tissue work better by utilizing natural forces. I mean that's way better than Dr. Frankenstein.
And it's not just light, I look into all kinds of different stuff, microcurrent technology, scalar technology, millimeter wave technology, different wavelengths of light, of course. But I look very broad and I'm constantly learning, and it's kind of a dance between reading studies, building things, and seeing people that need solutions for things. So it's that dance, and that dance, that's my life. That's what I live for.
I love that. Dr. Zuliak, in your area, okay, because you're dealing with medical doctors and I say regular people, but they're, you know, the general public. How are you increasing awareness? Because this is so different than what they're trained. They're trained that symptoms are bad, that diseases are bad. And you're talking about strengthen the body's immune system, that pain is there for a reason, and you're helping the body's processes. That's polar opposite. That's 180 degrees from where they were coming from.
Do you know, in my view, because I've been following this sort of pattern of thoughts, as I said, 25 years ago, I already talk about this, you know, saying that your symptoms are the expression of adaptation of the body to the specific condition you're in. So talking about these concepts, the inflammation is not a bad guy, inflammation is good, you know, all this. And I tell you, 25 years ago, it was controversy. 20 years ago was controversy. 10 years ago was still. But now I see the shift. And I think the shift is because we have younger people stepping in, people understanding technology is infiltrating their life every day. So they start understanding and they have relationship between technology and maybe health. And they're much more open to this concept. And I think our goal is to educate, because the more you educate, the more people start, you know, putting dots together. But we also need to produce evidence. Because as you know, mainstream medicine is based on evidence-based. Show me, prove me that works. So the more, you know, proof we have, the more they would start listen and be open. But ultimately, I'll tell you, today I was on a show, a physiotherapy show, Elevate, here in London. Great show, great reception. But, you know, even therapists, not just simple people, even therapists, when they see it works, they try FlexBeam, they say, wow, that is already better, you know. Of course, they do need evidence, but they go with the results. So I think the medicine, or at least the state of medicine, has to be result orientated. You get results, you know, here's your golden star. You don't get results, bad. So I think that needs to be implemented, the education and, you know, showing the demonstrating results.
I got something to add to that, though. I think one of the main reasons why this is actually happening is because of the crazy compartmentalization that has been taking place in science over the decades. And what we're doing is the absolute opposite. We're not compartmentalized. We look broad. We connect things together and we experiment. And I think that's the major difference. It's not like, okay, here's your task. You have to isolate this little thing so that you can influence that little thing. And you don't look any further than basically the horizon that you've been given. Whereas, you know, new medication, new science, new methods to support health, they need to take the opposite approach. They need to look at what are the natural states and how can we get back to them.
Yeah.
Revolutionary. Okay, how can people learn more about you folks, and how can they get their own FlexBeam? I know we got it like a $50 off special. I've got one FlexBeam that I'm using out of 3 people that live at my house, and one in the clinic that I'm sharing around. Okay, so, and I've ordered 2 of those brain wave changer thingies, and I'm going to experiment with those. How can they, and I know there's a $50 off, but how can they learn more about it? How can they get their own?
Yeah, I would encourage them to go to recharge.health to learn more. It's our website. Of course, if you want to try the product, this is again the thing is like we are empirical at the core. It's like that's the bedrock of science and in what we do. And so it's also for our users. Try one for yourself. There is a 30-day money-back guarantee. If somehow you're not getting results, then you can just return it.
Yes, I normally step in. If somebody doesn't get result, I can step in and look from medical perspective, from, you know, understanding. Maybe like, for example, referred pain. Yes, referred pain in the hip could be from the low back problem. Yes. So I would say, okay, guys, not just on your hip, put it on your back as well. And then they do it, and then we have result. So yeah, we have a
30-day money back guarantee. And if they're not getting results, they can call up the company and get you to answer a question like where. Yeah. Gee, that's kind of a no-brainer. Oh, and make sure when you're typing it in, because I'm not real good at the computers, it's recharge.health. Okay, so I've screwed up in multiple websites to find that out. And also there's going to be descriptions below the video. And I think you can also get it on the Dr. B VIP. We're going to have links on there. And because it's huge. I mean, this is cutting edge energy medicine. So the body can, and Dr. Zulia, the way you worded it, you're putting energy in the body. And all of a sudden I'm visualizing the mitochondria starting to produce more ATP, the blood vessels dilating. You've got the macrophages chewing up abnormally placed tissue and scar tissue and new tissue regenerating. And that's what actually happens. Yeah. Okay, Doc, can you name any drug that does that?
By the way, in cardiology, every drug is focused to get this vasodilation effect, So this nitric oxide release, they do at the expense of side effects, where the red light just give you this as a gift.
Yep, and that's also why we talk about nasal breathing. Mm-hmm. Nasal breathing, diaphragmatic breathing increases nitric oxide, okay, and that vasodilates and bronchodilates. So you're working with the natural processes of the body. Now, any final words, Doc, to get people to, we're taking the majority of the public that is in a chemically based, symptom oriented, that's the sickest population of animals the world's ever seen. We're taking that person into realizing that their body is more energy than matter, and that you change that energy, you change the cell production. What could you say and tell them in 30 seconds or less to totally change their world? How is that for hard? Okay.
Yeah. I think everybody should use it at home with family and just work preventatively. In my view, the whole mistake is that we always chase these symptoms when they become as a problem. Why not invest in your health now, before, and just stay nice and healthy at optimal energy, eating good food, having good thoughts, and just live the life healthy.
I got two words for you. I got two words for you. It's really simple. Self-sufficiency. I think this is a theme that is going to be more and more important in the future. We can see that in the whole world, things are becoming rather unstable. And I think self-sufficiency is extremely important. It's key. And self-sufficiency on healthcare is not just key, but it's essential. If you have the tools to keep yourself going, man, that's going to make a difference.
Yeah, your own regenerative thing. And I like our mad scientist in Thailand who just invented a thing for dental health.
Yeah. If I may add, yes, that we have an opportunity for people to invest in their own health. I have to mention that if any of your viewers are interested in a fundraising, a capital opportunity to invest in also the company, that's actually something we just opened up. So please feel free to get in touch, because we are trying to create something that we hope also with your help will actually become really big and one day a no-brainer for people to use.
Fantastic. I mean, Kat will put all those links below, but God bless y'all. Thank you so much. I know it's like probably midday where you are in the UK, or actually in the evening, it's midnight in Thailand. God bless you for coming together all from around the world. And you guys are cutting edge. I'm so honored to have you here. Thank you so much. And you guys are making a difference in the world. God bless you all. God bless you.
Thank you so much for having us. That's a pleasure. Great honor and pleasure.